Hello everybody, welcome to UroChannel. My name is Stefan Buntrock, I'm a urologist and sexologist, and in this video I will explain to you why you might be suffering from postmicturition dribble. This is such an annoying condition, and I am sure some of you have waited for this information for a long time. Postmicturition dribble is when you are done voiding, you step out of the bathroom and suddenly you feel that some urine has found its way into your underwear. Sometimes this may be so severe that a dark spot is forming on your pants. At the end of the video, I am going to show you my personal #1 treatment, which will work in the majority of men. But let's start with having a closer look at postmicturition dribble first, so that you understand the underlying cause of this. Postmicturition dribble is not what we call incontinence. In incontinence, there is an involuntary loss of urine directly from the bladder. For reasons I'm not going to explain in this video, urine manages to get past the sphincter muscle and runs out. In postmicturition dribble, the urine has passed the sphincter muscle voluntarily during voiding, but gets stuck in the urethra. The reason for this lies within the anatomy of that structure. The urethra is shaped like a U. So for complete drainage, the urine has to be squeezed out. This action is performed by a very small muscle, which belongs to the pelvic floor and which is attached to the urethra. It is called the bulbocavernosus muscle. Its contraction at the end of micturition empties the urethra from any residual urine. The problem is, these muscles get tight very easily. The reasons are numerous, but we must not forget that the pelvic floor is the mirror to our soul. Any bother in our lives will reflect upon the pelvic floor. It will respond with contraction. Tense, contracted muscles are shortened, so they don't possess their full range of motion anymore, which is a problem because for complete urethral drainage, an undisturbed pumping action is needed. Let me explain with this bicycle pump. The most amount of air comes out when it works at its full range of motion. If this would be restricted, the pump would be less effective. And this is exactly what happens with postmicturition dribble, in my opinion, in the majority of men. Besides pelvic floor problems, there may be other reasons like benign prostatic enlargement or scars in the urethra, so-called strictures. Professional advice so far has been limited to draining the urethra manually. This is done by putting one hand, let's say, beneath the scrotum or at the base of the penis and squeeze the urine out in a swiping motion. Despite benign prostatic enlargement being very common among men in midlife and older, the prostate is probably not the main cause. How do I know that? I stumbled over the solution during shockwave treatment in patients with pelvic pain due to an overactive pelvic floor. Postmicturition dribble is a very common symptom in these patients. As a rule, after only a few sessions, postmicturition dribble disappears. I have started to offer low-intensity shockwave therapy, ESWT, for postmicturition dribble, and so far it has worked every time. So what kind of magic do the shockwaves work? They can permanently release tension in tight muscles. In postmicturition dribble, this means the bulbocavernosus muscle returns to its full range of motion. Shockwaves are acoustic waves. The machine I'm using generates them in an electromagnetic fashion, and in addition to that, they are focused with a kind of parabolic mirror that is built into the applicator. This enables me to precisely target the overactive muscles. Are all shock waves equal? No. I'm talking about focused shock waves. Radial shock waves are not the same, as they don't have the same depth of penetration into the tissues and lack the accuracy of focused shock waves. For urological use, I pretty much regard them as useless. The treatment itself might hurt a little if there are tender spots within the pelvic floor muscles, so-called trigger points. Alternatives to shock waves include physical therapy, but make sure your physiotherapist is trained and experienced in treating the pelvic floor. If you are interested in learning more about shock waves, how they work, and what I use them for, check out this playlist. Thanks for watching. Bye-bye.